All right, welcome back. So next we will hear from three wonderful speakers focused on risk factors for perpetration and victimization. First, Dr. Maria Testa will speak on risk factors for college sexual victimization, the central role of women's heavy episodic drinking. Dr. Testa is a senior research scientist at the University of Buffalo's Research Institute on Addictions and an expert researcher focused on alcohol's role in sexual and intimate partner violence. Welcome, Dr. Testa.
Thank you very much. It's so exciting to be here already, and we're just getting started. I am giving an overview, and I only have 20 minutes to do this, so I feel like this is really pretty broad of an overview. I'm not covering anything really in depth. And as Sarah mentioned, it's critical that if we're going to prevent anything, we need to identify the risk factors. And I would add to that the mechanisms, which is the way the risk factors actually work to influence the outcomes. So as we've already heard, sexual victimization is highly prevalent and has all sorts of negative consequences. I don't need to reiterate that. And what I want to talk about in my talk is the importance of alcohol in a lot of these, not all of them certainly, but about half of college sexual victimization events involve alcohol, and the majority of rapes in college involve incapacitation rather than forcible rape. So clearly alcohol is something that we need to be aware of in seeking to prevent this. I want to just mention very briefly the definition of sexual violence. Different numbers for prevalence get tossed around, and they're not always exactly the same, and we've talked about measurement a little bit. There's different measurement definitions that are used. I'm not going to go into these. This could be an entire talk, but when I use sexual victimization, or SV to be quick here, it's a whole range usually. That's a much more comprehensive, often measured through the SES, but it could be something else. And when we talk about rape or attempted rape, that's typically defined as penetration using either force or incapacitation. And when I use incapacitated rape, I like to use a very narrow definition of it, which meets the legal definitions, and that is that the victim is unconscious, unable to consent, resist, passed out, so force is not necessary. It's not that she's merely drunk or impaired, it's that she's incapacitated. And that's often due to alcohol, to a lesser extent drugs, but it could be mental incapacitation or being asleep or all sorts of other things. And the drugs or alcohol may be administered by the perpetrator, but more often it's voluntarily taken by the victim. So first, I want to say that sexual victimization is hard to predict because sexual victimization is not something that you do, like your score on an exam or something like that, but it's something that happens to you. So clearly the victim is not the only person that's important here. The victim doesn't cause this to happen. It's the perpetrator that causes this to happen, and clearly it's not the victim's fault. But that said, there are some victim behaviors and characteristics that do increase the risk of being victimized. And as sort of a framework for understanding this, I use routine activities theory, and this comes out of criminology, and so some of the words are not the words that I would choose, but these are the words of the original theory. You need three things in order to have a crime, and this is any crime. Sexual victimization is just one of them. So you need a motivated offender. And so when you think about that here, not all men will perpetrate, but there are some who will. So you clearly need the offender. The word that they use in this theory is an attractive target. I'm reading that as a vulnerable target. And a lack of guardians, also sort of a funny phrase to use here, but I would think of that as like an isolated setting, because sexual perpetration is not going to occur in all settings, but it's much more likely in some of them. And so victimization is more likely with increased exposure via these lifestyle activities. So if it's mugging, if there's a dangerous neighborhood and people are walking there, they're increasing their risk. In no way does this mean that the victims are responsible in any way, but there is this sort of confluence that makes someone more vulnerable. And before I get into the risk factors I really want to talk about, I just want to mention the first one, which may be obvious. But that college women are vulnerable to sexual victimization. We know they're a vulnerable population, but that's primarily due to their being young women. And that is the segment of the population that's most at risk of being victimized. And as someone mentioned earlier, we used to think that college was a particularly dangerous time. And more recently, we find that the rates are equal or even higher in non-college young female populations. And as was also mentioned, that's what's so nice about these things all coming together, is that freshmen appear to be at higher risk. But that doesn't mean that upper-class women are not at risk as well. So these were the risk factors that I wanted to talk about: prior victimization, risk perception and responses, sexual assertiveness, alcohol with a star, because I'm an alcohol researcher if you can't tell already, and then sexual activity, consensual sex partners, and hookups. And these are ones that have been studied quite a bit. So prior victimization is a big one that comes up when we do these equations. If you control for previous victimization, it's almost always a predictor of later victimization. However, as Kate Carey reminds us, women who are not previously victimized are also at risk, so we can't count them out. I think a lot of the risk has to do with behaviors. So previously victimized women, we think, probably continue or possibly even increase some of their risky behaviors after being victimized in adolescence, and so that is accounting for the risk in college. But if other women take up these, freshmen, we think about taking up these risky behaviors, they are certainly at risk also. So I like to think about this as a mediated thing, but it doesn't explain all of the effect of prior victimization on later victimization, just mathematically. There's probably something unmeasured. So another risk factor is risk recognition and responses to risk. It's possible that vulnerable women are not properly recognizing the risk in a situation, or they don't know how to respond to risks that they're facing. And there are experimental analog studies, I think you'll hear about some of these things a little bit later, where you present women with a risky situation and see how they respond, and you often find differences that previously victimized women don't always recognize all the risks, or they wait longer to leave a dangerous situation. And in a review by Chris Giddett, she concluded, and this seems to hold up, that it's the deficits in the responses to risk more than the recognition that are particularly dangerous going forward. Women recognize the risk, but then they don't respond as well as they could, and that's associated with their vulnerability. And victimized women have these impaired responses. So there's a study that shows that women who waited longer in this hypothetical situation were later on down the road, several months later, were more vulnerable to being victimized. Sexual assertiveness is another risk factor that's been studied. Women who have lower sexual assertiveness are more vulnerable to being victimized. But there are also sort of a reciprocal effect that women who are victimized subsequently have lower assertiveness later. And this you could see how this could sort of spiral. And that's kind of related to risk responses. If you're in a situation where there's risk, responding assertively rather than passively can decrease risk. So now, alcohol. This is another big risk factor, particularly with college sexual victimization. HED is just our little shorthand for heavy episodic drinking, because we know that's sometimes a hard thing to say. So HED typically refers to for a woman drinking 4 or more drinks on an occasion. So it's enough for her to have a blood alcohol level of probably 0.08 or so she would definitely be impaired. And that's associated with all sorts of things. So it is associated cross-sectionally with being victimized. Women who are victimized report heavier drinking. It's also often, but not quite always, prospectively associated with later victimization. And where you get the strongest relationships, not surprisingly, is when you're limiting your victimization outcome to incapacitated rape or alcohol-involved rape. And that makes perfect sense. The women who drink more are particularly vulnerable to this type of victimization, but you don't always find that it predicts forcible rape. In fact, it typically doesn't when you separate incapacitated and forcible. So clearly there's another mechanism going on other than the alcohol. As I mentioned, half of all incidents involve alcohol, but half do not. And the majority of college rapes are incapacitated. Maybe 75, 80, even more % are incapacitated rapes among college students. Now, I've been talking about global risk factors. Women who have these characteristics are more likely to be victimized, but there is also some recent research showing that drinking on the daily level or the temporal level is associated with increased odds of being victimized later that day. So that's pretty compelling. So Kathy Parks has a study that drinking 4 or more drinks increased the odds by 19 times that there would be sexual victimization later that day. So pretty compelling role for alcohol. So I think it's particularly important to understand the mechanisms by which these risk factors work if we want to, figure out how to change things. So there's a few different ways that alcohol could be increasing vulnerability. The first one is incapacitation from alcohol, which is just a direct one. The woman drinks so much that she's incapacitated and someone could victimize her. There's an indirect impact due to impaired risk perception. I mentioned some of those studies. They're not recognizing the risk. They're not able to respond to it appropriately. It could also be associated via the drinking settings, because we know that college women don't drink by themselves. They don't drink 1 glass of wine with their dinner. They're drinking in drinking settings that have their own risks. It's also possible that HED is a marker of other risk-taking characteristics, such as impulsivity or seeking out risk or something like that. And I'm not really going to talk about that one, but that is a possibility. So incapacitated rape, as I mentioned, this is non-consensual sexual activity due to the incapacitation of the victim. So she's unconscious, she can't object or consent, and there's no force necessary. This does meet legal definitions. However, it's almost never prosecuted. Bill Cosby case is quite unusual, but women who are victimized due to this are considered unreliable witnesses because they don't remember anything, and lawyers don't want to take this on. So this is pretty common, but is rarely prosecuted. As I mentioned, it is the most common type of college rape, and it is predicted by HED. Forcible rape typically is not predicted by HED. It may involve drugs, roofies as people call them sometimes, and in doing focus groups with young women and with their parents, there's a tremendous amount of concern about somebody dropping something in their drinks and being very, very worried about this. The studies that have looked at this suggest that this is not terribly common, and it's usually alcohol, and even women who have some kind of drugs in their bloodstream often have alcohol, suggesting they were very intoxicated at the time, and that was why it was easier for this drug to get into their system. But that is sort of a common, I don't know if it's exactly myth, but that it's sort of inflated in importance, and the importance of heavy episodic drinking seems to be kind of diminished. This comes from not a college study, but this was when incapacitated rape was really first recognized, and this was from a community study that I did many years ago as a child. And we actually noticed, we did interviews with 300 women who had been victimized. Out of a sample of about 1,000, we had 300 and some. And this was when we had time to do qualitative analyses of these very interesting transcripts. And we found that they fell out, they were very different. There were 2 different types of rapes. The forcible ones were horrible to read. They were what you would expect rapes to sound like. But the incapacitated ones sounded very, very different. I don't even think that word was used very much before that time. But they had this very fuzzy, dreamlike quality, and that this is the reference if anybody wants to read that. But these were just some quantitative comparisons, which I think helped to cement the differences between these 2 experiences. So if you look at the substance use, all of the incapacitated rapes, of course, had alcohol or drugs. There were very few that had drugs only. They were mostly alcohol or some with alcohol and drugs. But of the forcible rape incidents, there's actually an error in there. 75% had none. 25% had alcohol. And when you go down to the number of drinks, this was a huge difference. So the forcible rapes, of those 25% that had alcohol, the average was 4 drinks, which is certainly enough to be impaired. But But look at the incapacitated rape, 9 drinks. That would be a blood alcohol level of about 2.0 rather than about 0.08. And when we had them rate their intoxication on a 1 to 7 scale, again, huge differences. About a mid-range intoxication for the forcible and 6.7 out of 7 for the incapacitated rape. So these were very different experiences. So that was the first mechanism, the direct one. There's also a potential indirect impact due to the impaired risk perceptions and responses. And I think when people think about alcohol's role in victimization, I think this is what they think of, that women have poor judgment, that they're hooking up, they're doing these risky things because they're under the influence, they're not able to quite handle themselves. And there is, in fact, evidence that alcohol at moderate doses, and in laboratory studies, I'm sure Tony will be talking about this later, we typically use a blood alcohol level of 0.08, which is about 4 to 5 drinks for a woman in a short time. And it indeed does impair cognition, judgment, risk perception, responses, increases risk-taking. There's a recent review that concluded that. And I talked about some other risk factors, assertiveness, risk recognition and responses, so clearly the impairment due to intoxication can influence those. These were just some of the studies that had suggested that. So the third mechanism that I wanted to talk about was the association via drinking settings or environments. And these pose a risk for sexual assault independent of drinking quantity. So if we think about the settings where college students typically drink, they're parties, or as they get a little bit older, they're bars. So these are sexually charged settings. Sexual advances are normalized and considered just sort of par for the course. We know a lot of these are going on. Men perceive women who are drinking as being more sexually interested, so they are more likely to approach them. They attract people who are seeking to hook up and meet partners, and they can even attract predatory men. We don't know the degree to which they do that, but certainly this is a setting where there's a lot of intoxicated women. And to go back to that language of routine activities theory, the guardians here are no doubt intoxicated as well. So they may not be the best guardians because they may fail to notice some of the things that are going on. On the other hand, the severity of the victimization that occurs in these more public settings is probably diminished by the fact that it is in public and there are other people around. But still, there's all sorts of things going on. And interestingly, we just did a whole bunch of focus groups. Women do clearly recognize the dangers associated with these settings, and they talk about ways that they try to mitigate them, such as keeping your drink with you at all time and covering it. That's one of the ones that comes out first. But they still go to parties and bars, and people have unrealistic optimism about their ability to avoid bad things, and so they all think that they can handle these settings. So even within these drinking settings, there's a couple ways that risk can happen. There's the direct risk of just being in these settings. There's unwanted sexual advances, which often, they can be as low level, but certainly unpleasant as creepiness, someone encroaching on your personal space, things like that. Or they can be indirect because the public drinking settings can lead to hookups or other sexual activity. And I would argue that these are more dangerous because of the isolated private nature of those, when you're off having sex with someone privately. So we know in general, this was my last of the big risk factors, is women with more partners and more hookups are more likely to be victimized. This could be just due to greater exposure to more men, reflecting individual differences in risk-taking. But we have to recognize many sexual victimization events start out as consensual, and they could take a certain turn, and without communication, they could go in a negative direction. We have to recognize that it's not just hookups, though. An awful lot of victimization is from previous partners, boyfriends, steady people. These data come from perpetrators, but Clearly, a lot of them have had previous sex. They're partners. They're not just strangers or one-night stands, as we might have thought about it. So hookups are risky, certainly. Sexual encounters are risky, and alcohol makes them more risky. I just came across a very recent study showing that hookups with alcohol, and they looked at 7,000 hookups, are more likely to end up in rape if alcohol is involved. I'm talking faster now. So this is sort of a summary. The central role of alcohol, it's both directly, it's indirectly related, and it's involved at the event level as well. So it's sort of at all different levels of this. So what are the implications of this for if we want to prevent? Well, alcohol is heavily involved at different levels. Is it a cause of sexual victimization? I'm not going to answer the question. I'm just going to throw it out there. And then, do we intervene with the victims, with the perpetrators, or, as Sarah suggested, with the whole environment and the whole thing? And I'm kind of leaning towards that, and after she talked, I'm really convinced about that. And another thing that comes up a lot is some people will say it's victim blaming to intervene with women or to even suggest that it has anything to do with women. And my position is always that I'm not blaming women, but it's unethical not to share what we know. We are doing this research. We're finding out what makes women vulnerable. And I certainly talked to my daughter as a teenager, and I think you would probably talk to yours too. I also presume that women are more motivated to avoid being victimized than perpetrators are to avoid perpetrating. But environmental interventions may be particularly appropriate because sexual victimization involves, a setting. So we could very simply try to just reduce women's drinking. And I have made the argument that if you got women to not drink to these very high levels, you could pretty much eliminate incapacitated rape. There's lots of alcohol interventions targeting the intervention, but they haven't been all that helpful in reducing rates of sexual victimization so far. We could also try to make drinking safer, and that is what women talk about trying to do. And I think bystander intervention and friend kind of monitoring would fit into that category as well. Women are drinking, they're in these settings, but they're going to do things to mitigate the risk. And I mentioned that we have to keep in mind that we might be working on assertiveness or bystander or other kind of risk reduction efforts, but if the people that are the safety monitors are intoxicated, that's going to impair their ability. So I'm kind of left with, I think environmental interventions offer all sorts of promise because they're influencing the whole environment. There are some very exciting studies showing that campuses with lower rates of HED have less incapacitated rape. That goes way back. Campuses with more restrictive alcohol policies have lower sexual victimization and lower rates of heavy episodic drinking. So these seem quite promising to me, and I hope that campuses, which have the opportunity because they're more closed systems, to look into some of these. So I covered a lot in a short time. A lot of this is in a chapter that's coming out very soon, this review, and I am happy to take questions.
That was absolutely fabulous. I don't know how you managed to distill all of that.
I talk fast.
It's awesome. So the more restrictive alcohol policy, I wonder if you could say just a little bit more about that. Is it, is it putting more sort of alcohol-related sort of treatment? Is it more like you're going to be punished if you have alcohol on campus?
It was a whole range. That's the SALT study, which I would encourage you to look up. They actually, I think that's the study where they just counted up how many different things they do. Do you allow alcohol on campus? Do you restrict the I think they added up how many, and the ones that had more restrictive ones. This is not my area of expertise, but I think this stuff is really exciting. Yeah. I've left you mystified. Is there another question?
Okay, we have time for one more. Coming from the back.
Thank you. That was just a wonderful, very quick but very thorough presentation. I'm like, I have all this new language. So I'm one of my jobs is as a sexual assault nurse examiner, and so incapacitated rape is like the first time I've heard that language, and so it was amazing and revelatory for me. But a really common story or experience that I hear are people saying, I just had one drink and I don't remember anything else from the night. And so I think it really goes into this idea of the date rape drugs, and somehow that being drugged makes it not your fault, as opposed to, oh, actually I had 10 drinks, but I really only remember having
really big drink.
Exactly. And so I was wondering if you had any additional experience or insight onto that, kind of putting the blame or the focus on a date rape drug as opposed to what is really an alcohol-related issue.
Yeah, I think that's a lot of it. I'm a psychologist, and people want to have self-protective kinds of strategies, and I think that fits into that. And I think there's other people, Dean Kilpatrick, who looks at voluntary intoxication versus someone administering the drugs, and usually it's the voluntary intoxication. Someone might be encouraging, but there's a lot of voluntary consumption. Yeah, I think you're right. Okay?
Okay, thank you, Maria.